In response to COVID-19, PSP is offering virtual fitness to Canadian Armed Forces members. By using social media platforms, the virtual fitness classes tailored to the Canadian Armed Forces personnel becomes accessible to all. Participants who are not Canadian Armed Forces members recognize and acknowledge that their age, health status, and physical fitness level are unknown, and it is entirely up to each individual to assess their ability to participate in this class. Since it is preferable to consult your physician before beginning any exercise program, we invite all participants who are not Canadian Armed Forces members to consult the Get Active Questionnaire of the Canadian Society of Exercise Physiology and its reference document. If you experience any pain or difficulty during the exercises presented in this video, it is recommended that you stop and consult a healthcare provider. If CAF members sustain an injury during this video, please remember to fill out a CF98. We're now going to do a cool down. If your heart rate is still high and you're breathing hard, keep marching on the spot to help bring your heart rate down and control your breathing. You can go through these movements as you march on the spot. It just takes a little more coordination. So we're going to start with some shoulder rolls, similar to what we did in the warm-up with the shoulder circles. If you prefer to do shoulder circles, you can do that instead. This is a little easier given that we're trying to bring our heart rate down, not get ready for movement. Switch directions when you're ready. Try to make those circles as big as you can. Then we're going to bring one arm across our body, give it a hug. Remember to keep your shoulder down. So we don't want to be way up here with our shoulder up next to our ear. Trying to keep your shoulder down away from your ear. And then we'll switch to the other side. Same thing, pulling that arm in as far as you're able to go or as far as you can comfortably go. There should be no pain with any of these stretches. All right, let's take a deep breath in, reaching up nice and high, over to one side. If you're standing, you might want to take a slightly bigger stance, so wider feet instead of feet close together. But you can also do this with your feet close together. It's your choice. Deep breath as we come to center, and exhale as we come into the other side. Trying to stay up nice and straight. Coming back down. I'm going to change my sitting position. If you are standing, you can do a side lunge to one side. If you're sitting, we're going to move into butterfly stretch. Sitting up nice and tall, feet close together. If you're standing, you're going to be doing the side lunge similar to what we did in the warm-up. Right here, arms out for balance. And if you're standing, we'll switch sides. If you're sitting, you can stay in that butterfly position. All right, if you are sitting, you're going to want to come onto one knee. If you have a pillow, feel free to grab it and put it underneath your knee. We're going to have this knee directly underneath our hip. This leg here is for stability. We're going to gradually lean forwards onto this front leg. If you're standing, you don't want to get down onto one knee, find a step or something to put your foot up on. And you're going to be here. Now, if you have a really high step, you don't even need to step back. Just need to be up close to the steps, getting the knee up to hip level. However you do it, whether you are on your knee, whether you lift up your knee to hip height, doesn't matter. This is also variation. If you're finding that this one is too easy, coming up to a step to lift up your front foot makes this a deeper stretch. And if you're ready, lifting up the arm on the same side that we're stretching, so the knee on the floor or the knee pointing down, we're going to lift up that same arm. And then we'll switch to the other side. Again, I'll show you a couple different views. So the first one we have is here. If you need just a slightly deeper stretch, shifting your weight forwards onto your front leg. And once you open up and add the arm, it's going to look like this. If you need a deeper stretch, Finding a step for your front leg, or if you don't want to be on the ground, you can be standing and just make sure that this knee gets up to roughly hip height. And again, we're reaching up. All right, let's move on to hamstrings. So if you're kneeling, you're going to stay in that kneeling position and just bring your front toes up towards the ceiling. If you're getting a stretch here, just stay here. If you need a bit more of a stretch, you're going to push your hips back and start to lean down towards your toes. If you are standing, again, you'll want a chair or a step to be here. Now you can do this with your legs straight. If you're leaning down, make sure you're moving from your hips, pushing your hips back, and then reaching for those toes. And we'll switch. So whatever variation you're doing, whether you're using a step, if you want to sit into this and keep your other leg active, you can. Now we're going to do a figure 4 stretch. If you are standing, you're going to want to find a chair to sit on. If you are sitting, you're going to bring one ankle across our knee, like so. Sitting up nice and tall. If you need to bring this leg in towards you, you can to get a deeper stretch back here. Or want to keep this leg perpendicular to this one. So if your knee is up like this, you're going to push down just a little bit, not too hard. Now be careful with this. You might have noticed that as I brought this knee up, I started to round my back. You want to keep your back straight. So that might mean that you're not very high with the bottom leg. You might only be here. If this feels okay, and if you're able to keep your back straight, you can bring in the bottom knee. If you are sitting, it's going to be across the leg. If you need less of a stretch, you're going to straighten out your bottom leg. If you need a deeper stretch, you're going to bring that in, and let's switch legs. So this one's a bit tighter for me. I have to lengthen my bottom leg to accommodate this one. I'm going to add a bit of pressure on my knee here. Not too much. I don't want to be hurting either my knee or my hip. Just enough pressure that I feel the stretch. So very light pressure here on the knee. All right. If you're sitting on the chair, feel free to stay there. If you're on the floor, you can move to a cross-legged position or whatever position is comfortable for you. We're going to take our fingers, interlock them, reach forwards, round our shoulders. And if you're ready, you can drop your head. Now with this stretch, we are allowed to round through our back. This is similar to the cat position of the cat-cow stretch. Let your shoulder blades come apart, relaxing, lengthening through our spine. Then we're going to pull back, opening up the chest, reaching back with your fingertips. If you notice too much of a stretch as you reach back with your fingertips, focus on pushing the back of your hand to the wall behind you. But if you want a deeper stretch, point those fingertips back. You'll notice it down your arm, into your hand, maybe even into your neck. As long as it's not painful, you can keep going. Let's drop our hands to our sides. Take one hand, push it down to the floor, and tilt your head away. Couple deep breaths here. And then we'll switch sides, taking that palm, pushing down to the floor, and tilt away. By pushing down to the floor, we make sure that the shoulder does not pop up. We want to make sure that the shoulder stays down so that we get a really good stretch here in our neck. Hands again by your side or on your lap. Tilt your chin down towards your chest. If you're able, let your chin rest on your chest. And then looking up towards the ceiling. We're going to finish off with a couple deep breaths. You can go at your own pace. This first one we'll do together. Deep breath in through your nose and out through your mouth. Let's do 2 more going at your own pace. In through your nose and then out through your mouth. And you are done. Good work.